In Somalia, a country long plagued by conflict, drought, and poverty, another crisis is quietly taking its toll: low vaccination rates and growing malnutrition. In the city of Baidoa, healthcare workers are doing what they can, but international aid cuts are threatening the fragile progress. DRM's report begins inside a health center where hope and hardship collide. Inside a health center in Baidoa, Somalia, a medic gently administers immunization drops to a crying baby. The child's mother clutches her tightly, a small act of comfort in a country where vaccination and nutrition remain critical yet alarmingly scarce.
We receive an average of over 60 people every day. Vaccination is given to those who have completed the vaccination process. Those who are vaccinated come from the camps and remote jungles. If vaccination runs short, we fear diseases will increase and spread. The diseases include whooping cough and polio. If they are not immunized, the diseases will spread.
At Baidoa's Bulajadid Health Center, supported by USAID and Save the Children, doctors say demand for vaccinations is rising. The facility sees more than 60 patients daily, many of them walking for miles from camps and remote villages.
My name is Kadro Hassan Abdullah. I come to this clinic to get nutrition biscuits to give to my children who are malnourished.
Somalia's fragile healthcare system now faces a worsening threat: international aid cuts. And for a population already battered by climate change, the loss of assistance could mean catastrophe.
There are enormous. Many communities, many children, many families are very vulnerable following drought years over the last few years, the loss of livelihoods, the loss of livestock, and they're in desperate need. And at the same time that they face desperate needs with drought, with climate change impacts, they're of course suffering now the impact of aid cuts.
Mothers like Kadro Hassan Abdullah continue to show up at clinics in search of help. After her child was diagnosed with malnutrition, she received high nutrition cream to begin the fight back to health. But experts warn, without sustained support, progress is at risk of unraveling. Funding in decline and needs rising, Somalia stands at a tipping point. For thousands of vulnerable children, access to vaccines and nutrition isn't just a service, it's a lifeline. Stay with DRM News for continuing coverage on this humanitarian emergency.